Bienvenidas y bienvenidos a esta presentación de los lineamientos
Welcome to this
nacionales sobre
presentation
políticas de
on the
alimentación
regional guidelines
saludable y
on
actividad física en
healthy
entornos
food
escolares. Mi nombre
policies
es
and
Leslie
physical
Bejar, soy
activity
oficial
in
técnico en
school
manutención de sistemas
environment. I
alimentarios
am
de la
Leslie
Organización para
Bejar
Enfermedades
on
de la Salud.
the PAHO
Y para mí
organization.
es un honor y
It
un
is
gusto
for me
poder
a
darles la más
pleasure
cordial
to be
bienvenida
able
a
to
este
give
evento.
you the most warmest of
Voy a
welcomes to
pasar
this
a
webinar.
darles unas
I will give
indicaciones
you some
breves
short
sobre
indications about
la interpretación simultánea.
our simultaneous
Si
interpretation.
buscan en la parte
If you look in
inferior
the lower
de
part
la herramienta de Zoom, pueden
on
hacer
your
clic
Zoom
en el
tool
icono del globo de
toolbar,
interpretación
you have the globe
y
icon,
seleccionar el
and
idioma
you
de su
can choose
preferencia.
your
Tenemos
preferred
interpretación en
language. We
español
have
y en inglés.
interpretation in Spanish and English.
For icon of interpretation that is located in the Zoom toolbar and select your preferred language. We had simultaneous interpretation in English and Spanish. And to hear only the interpretation audio, turn on the mute original audio.
Para escuchar.
And without further ado, I would like to welcome Dr. Ansel Hennis, who is the Director of the Non-Communicable Diseases and Mental Health Department of the Pan American Health Organization, to provide us some opening remarks for this event. Over to you, Dr. Hennis.
Yeah, thank you so much, Leslie. Good morning, good afternoon, and good evening to everyone joining us from across the Americas and beyond. On behalf of the Pan American Health Organization and the Organization of American States, I am delighted to welcome you to this webinar for the presentation of the regional guidance on healthy eating and physical activity policies in school settings. We're joined today by colleagues from Ministries of Health and Education, academia, civil society organizations, technical cooperation partners, and many others who share a commitment to ensuring that children and adolescents in the Americas grow up in environments that support their health and well-being. Your presence reflects the breadth of action that this agenda requires and that this guidance was designed to inspire. The numbers speak for themselves. In 2022, 37.6% of children and adolescents between the ages of 5 and 19 in the Americas were living with overweight or obesity. And in 2016, the most recent data available, over 80% of adolescents in our region were not meeting recommended levels of physical activity, with girls consistently showing higher inactivity than boys. These are not abstract statistics. They represent girls and boys whose health trajectories, educational outcomes, self-esteem, and quality of life are shaped by the environments in which they live, learn, and play. Schools sit at the heart of this challenge and its solution. Every school day, millions of children make choices about what they eat and how they move within environments that either support or undermine healthy behaviors. Regulating food and beverage sales, restricting their marketing, advertising, and sale of ultra-processed products, promoting physical education, active classrooms, active recesses, and active transportation. These are not peripheral concerns. They are the core of what schooling and going to school is intended for in terms of health and well-being. The regional guidance we are presenting today is the result of a structured, evidence-informed, sustained, and country-driven process. Since 2022, the Hemispheric Program on Healthy Eating and Physical Activity Policies in School Settings, which is a joint initiative of PAHO and the OAS, has been building national capacities and systematizing experiences across the region. Following a regional call in 2023, the Bahamas, Belize, and Colombia were selected for intensified technical support. Their lessons were documented and systematized through ongoing technical exchanges, field-based learning, and comparative analysis, generating insights on policy design, implementation, monitoring, and intersectoral coordination that directly shape this document. Feedback from Ministries of Health and Education, collected in October of 2025, was also incorporated into the final version. The result is a practical, flexible, evidence-informed instrument. It tells countries not only what is needed, but how to do it as well. And it can be used as a whole or by section, depending on where a country is in its policy cycle. It speaks to national and subnational teams, to educators and health professionals, to policy designers and program implementers alike. Today, we present the final version of this guidance, and this webinar is itself part of our ongoing process of technical dialogue with member states and will contribute to their understanding and ownership in preparation for future phases of adoption and implementation at the national level. We want you to leave today not only with a deeper understanding of the document, but with a sense of ownership, because it belongs to all of you. Let me close by expressing my sincere gratitude to everyone who contributed to this process. The governments of the Bahamas, Belize, and Colombia for their commitment and openness, our OS colleagues for their partnership, the Ministries of Health and Education across the region, and all the technical experts and advisors who enrich this work. We're excited to share this collective milestone with you. Welcome, and let's get started.
Thank you very much, Dr. Hennis. Now we are going to move forward. Ahora vamos a pasar, vamos a cambiar a español y me da mucho gusto darle la bienvenida y darle
Let's
la
switch
palabra
to
a
Spanish and
Jesús
allow
Giacomelli,
me
quien
to
es
give
director del
Jesus
Departamento de Desarrollo Humano,
Giacomani, who
Educación y
is the
Empleo de la
director of
Organización de
the
los Estados
Department of
Americanos, para que nos dé unas palabras de bienvenida y para que
OAS, so he
también
can give us a
abra este
welcome
webinar dando un contexto
words
general
and
del
to
programa
speak this
hemisférico y del
webinar to
propósito
give us
de
a general
nuestros lineamientos
context on the
regionales. Adelante,
hemispheric
Jesús.
context and the
Gracias, Leslie.
guidelines
Dr.
here.
Hennis, qué gusto
Thank
verla.
you, Leslie,
Vanessa,
Dr. Hennis. It's a pleasure to
representación
see
de
you.
salud
Vanessa, the Ministries of
que nos
Education and
acompañan.
Health that are
Muchas
here with
gracias
us
por estar aquí.
today.
Muy buenos
Thank you
días
very
a
much.
todas
Thank
y
you,
todos. Es un
everyone.
honor darle la
It is
bienvenida a
an
miembros de la
honor to give
Administración
you
de los Estados
the
Americanos y del
welcome on
Departamento de Desarrollo
behalf of
Humano, Educación y
OAS
Empleo
and
a
the
este
Department
webinario
of
para la presentación de los
Health
lineamientos
and to this
regionales sobre
webinar and the
políticas de
presentation of
alimentación
the regional
saludable y
guidelines on
actividad
the
física en
policies
los
of
grados escolares.
healthy
Quiero
food
agradecer especialmente a la
and
Organización Panamericana de la
foodstuff. And I
Salud,
want to
nuestro
thank
socio
PAHO,
estratégico
our
en esta iniciativa,
strategic partner in
así
this
como a los
initiative, as
representantes de
well
los
as the
ministerios de Educación,
representatives of the
Salud,
ministries of
Academia y sociedad
Health,
civil
Education,
y demás
academia,
organizaciones
civil
de otros
society,
países
and
que nos
other
acompañan.
cooperation
Este
and
documento
entities that are here with
representa el
us today.
resultado de un
This
esfuerzo
document is the
colectivo
result of
que
a
comenzó hace
collective
varios
effort
años en el
that
marco del
started
Programa
many years
Hemisférico
ago
sobre
in the
Políticas de Alimentación
framework of the
Saludable y
hemispheric
Actividad
program on
Física en
policies of
entornos escolares.
healthy
Una
eating and
iniciativa
physical
conjunta de la
activity
OEA y
in
la
the school
OPS orientada a
environments.
fortalecer
A
las
joint
capacidades de los
effort
países
of
para
OAS and
promover entornos
PAHO
escolares más
to
saludables
promote
en
a
las Américas.
healthier
La necesidad de
environment
actuar es
in
evidente.
schools in
Nuestra
the
región,
Americas. So
en
the
su
need to
peso, la
act is
obesidad
obvious.
continúan aumentando.
Our region,
Entre niños, niñas y
obesity
adolescentes,
and
mientras que los niveles de
overeating is
inactividad
still
física
continuing
siguen
to
siendo
increase, and the
alarmantemente
physical
altos.
activity
Estas
is very
tendencias no
low.
solo afectan la
Now,
salud y
these
el
trends are
bienestar de las
not only
personas, sino
affecting the
también
health and
sus
well-being of
oportunidades de
people, but
aprendizaje y su
also their
permanencia en la
opportunities
escuela
to
y su
learning, their
desarrollo integral.
permanence at school,
Por
and their
ello, estos lineamientos parten de
integral
una premisa
and
fundamental.
comprehensive
La
learning.
salud y la
This comes from
educación
a
son
premise.
inseparables.
The
Las
health and
escuelas
education
no
are
son únicamente
inseparable.
espacios para
Schools
la
are not
transmisión de
only the spaces
conocimientos,
to
son
transmit
entornos
knowledge.
donde se
These
forman
are
hábitos,
environments
valores
where
y
you have
competencias que
habits,
acompañarán a
values,
las personas a
and
lo largo de
skills
la
that
vida.
will continue
Cuando
with the
promovemos una
people throughout
alimentación
their lives.
saludable y una
When we
actividad física
promote
en
a
las
healthy
escuelas,
eating and
también estamos
physical activity at
fortaleciendo las
school,
trayectorias
we also
educativas,
are
el
strengthening the
bienestar socioemocional,
educational
la
and the
participación activa y
well-being,
las
active
oportunidades de
participation,
aprendizaje de
and
la
the
nueva
learning
generación.
opportunities of a new
Estos
generation.
lineamientos son el
These
resultado de un
guidelines
proceso
are the
regional
result
basado
of
en
a
evidencia,
regional
diálogo
process
técnico
based on
y
evidence,
aprendizaje entre
technical
países.
dialogue, and
Incorporan las
learning
lecciones
between
derivadas
countries. They
desde
include
Bahamas, Belice y
the
Colombia, así como
the
los aportes
experiences in the Bahamas, Belize, and Colombia, as well as the ministries of health, education, and sports in the region. It is not willing to have a unique model, but to be flexible enough to be able to be adapted in their priorities and the national context, reflecting one of the major strengths of the inter-American system, the capacity of meeting amongst different actors through common objectives. We need the coordinated action between education, health, sports, agriculture, social protection, local governments, and educational community. The regional experience shows that the best results are shown when we work together. We hope that this document will contribute to reinforce the public policies, to enrich the dialogue between health and education sectors, and to support the countries in their efforts to build the schools that promote well-being, equity, and the comprehensive development of children and adolescents in the Americas. Thank you for your participation in this effort. And as Leslie said, I will go to the next point, that is a presentation on the topics that we are going to be speaking about. I will now share my screen.
Creo que entonces quiero
I think
confirmar nada
that
más si se ve
I
la
want to
pantalla.
confirm if you can see it in my screen.
Perfecto.
Yes,
Muchísimas
thank you.
gracias.
Okay,
Entonces,
thank
esta
you
va a ser
very
la
much.
presentación de
This
los
will be the
lineamientos regionales
presentation
sobre
of the
políticas de
regional
alimentación
guidelines on
saludable,
the
de
policies
actividad
of healthy
física en
eating and
entornos
physical
escolares.
activity
Como les
in
acabo de
the
decir, fue un
school
gusto darle la
environment.
bienvenida
As I said,
a
it
esta
was a pleasure
presentación
to give you
de
the
los
welcome
lineamientos
to this
desarrollados
presentation of the
conjuntamente por la
guidelines that
Organización
were developed
Panamericana de la
together
Salud y la Organización
by
Mundial de la Salud.
PAHO and the
Quisiera
OAS.
comenzar
I would like
agradeciendo
to
a los
start
ministerios de
thanking
Educación y
the
Salud de los
ministries
Estados
of
miembros, así
education and
como sus
health
equipos
of
técnicos,
the
academia, y a la
ministries
sociedad
of
civil y a nuestros socios de
health
cooperación
and education
por
to civil
ahora
society
estar
and our
contribuyendo a este esfuerzo
that is
colectivo.
contributing to
Más que un
this
producto
collective
técnico, estos
effort.
lineamientos
More
representan
than
el
a
resultado de
technical
varios años de
product,
diálogo,
this
cooperación
is a
y
result of a
aprendizaje
different
compartido
lines,
entre los
years
países
of dialogue,
participantes.
cooperation, and mm,
Antes de entrar al contenido de los
and
lineamientos, me
before
gustaría explicar
starting with
brevemente el
what we have
contexto
in our
institucional
guidelines,
y
I would like to
político en
give
el
you
que
my
surge esta iniciativa.
background
Los
on
lineamientos
which this
regionales sobre
initiative is
política de
sitting.
alimentación
The
saludable y
original
actividad física en
guidelines
entornos
on
escolares
the
no
school
es una actividad
environment,
aislada, forma
physical
parte de un proceso
activity,
más
and it's
amplio
a part of
impulsado por los
a
ministros de
broader
Educación de
process
las Américas para
by the
fortalecer
ministries
la
of education
resiliencia
of the
de
Americas
los
to
sistemas
reinforce
educativos
the
y promover
resiliency of
respuestas
the
integrales
educational
frente a los desafíos
systems and to
que
promote
enfrenta nuestra región.
integral activities in
La
on
Agenda
facing the
Educativa
challenges of our
Interamericana
region.
2022-2027,
The
aprobada por los
Inter-American
ministros de Educación de las
Agenda
Américas, estableció dos
2022-2027,
grandes
approved by the
áreas de trabajo.
ministers
La
of the
primera,
Americas,
un enfoque
established two
sistémico para
main
la
issues.
construcción de
One is
sistemas
systemic
educativos
focus
resilientes que incluye
to
iniciativas
have
relacionadas con la
the
continuidad
initiative
educativa,
related
la
to
transformación digital
these
y la
the trans
participación democrática en los
the
entornos educativos. La segunda,
educational
orientada a desarrollar.
transformation in
Se
the
reconoce que
educational
muchos de los
systems.
desafíos
The
educativos
second
actuales no pueden
is
ser
the
abordados
development
únicamente
that
desde el
cannot
sector
be
educación.
faced
Es
upon only from
precisamente
the
en este segundo eje
education
donde se
sector.
ubica
It
el
is the
programa
second
hemisférico
axis
sobre
that we
políticas de
have this
alimentación saludable
hemispheric
y
program on
actividad
healthy food
física
and
en
physical
entornos
activity
escolares.
policies in school
Este enfoque
environment.
reconoce que el
This
bienestar, la
focus
salud y la educación
acknowledges that
están
the well-being,
profundamente
health, and
conectados
education
y que los
are
resultados
deeply
educativos
connected,
dependen
and that
también de
the
las
educational
condiciones que
results
faciliten
depend on the conditions
por
that go
ello, los
beyond
ministerios de
the
Educación, Salud
the
y
school
Deporte
classroom.
solicitaron avanzar de
That is
manera
why
conjunta en
the
esta agenda,
ministries of education
promoviendo escuelas
and
que
health and
favorezcan tanto
sports
el
promote
aprendizaje
schools that
como el
favor not only
bienestar
learning but also
integral de
the
los
full
estudiantes.
and the comprehensive well-being of
Con
students.
este mandato, la
And with this
Organización de Estados
mandate, the
Americanos y la Organización
OAS and
Panamericana de la
the
Salud
PAHO
pusieron en marcha este programa
started
hemisférico
this
que le
program,
llamamos
a
PASAFE.
hemispheric
El
program
propósito ha
that we
sido
called
acompañar a los
PASAFE.
países en la
The
identificación,
purpose was to accompany countries in having public policies oriented to have a healthier environment for schools. This program was designed on three principles: the technical cooperation, experience exchange, and the construction of knowledge. The objective was never to have abstract recommendations, but practical tools built upon the experiences and real experiences of the countries in the region. 11 projects. In 2023, we had a calling, a hemispheric calling, to identify experiences that could feed this process. We received 11 proposals coming from different member states. Then 5 were pre-selected, and finally, we chose 3 countries to receive this technical assistance that is focused with BAHO, that is Bahamas, Belize, and Colombia. These are 3 different realities on Caribbean, Central America, and South America that allowed to generate important evidence on the design, implementation, monitoring, and the coordination between the policies related to healthy food and physical activity policies in school environment. The experiences of Bahamas, Belize, and Colombia were systematized during 2 years, and these lessons were enriched with consultation with the ministries of health and education in the region, and through the inclusion of the PAHO technical knowledge. It is important to show in this results that this is not mandatory nor a sole model for all countries. This is a flexible tool that can be adapted to the priorities, institutional capacities, and the national context of every member state. This is just a technical socialization stage in the countries before having the desires of each state for its presentation and adoption. Through the next steps, these guidelines will be shared with the Ministries of Education of the Americas in the 12th session of Education Ministers that will be held in Quito, Ecuador at the end of this year. This will allow to continue promoting dialogue between health and education to continue with the well-being of the next generation. I would like to reiterate our thanks to PAHO on the technical leadership and the Ministers of Education, Health, and Sports that participated in this process. We trust that these guidelines will help enforcing the regional cooperation and support the countries to build the environmental environment for schools. And I would like to invite our PAHO partners to present the main guidelines and technical components. Thank you very much. Thank you, Jesus, and thank you for all your support and collaboration during this process and in the frame of this hemispheric program. We would like to share now a video that shows a little bit this, that Dr. Hennis was already and Jesus speaking on areas, but we would like to show it more possibly and more simply, and what was this process here.
1 in 3 children and adolescents lives with overweight or obesity, and 4 in 5 children are physically inactive. Unhealthy environments and the lack of physical activity affect children's health, well-being, and learning, as well as the socio-economic development of countries.
Education and health must work together in an integrated manner to transform realities. Given this reality, under the leadership of the Ministries of Education and Health of the Americas, the OAS and PAHO launched the hemispheric program on healthy eating and physical activity policies in school settings.
Schools are key environments for promoting healthy lifestyles from childhood. This program facilitates the exchange of tools, experiences, and lessons learned among the education, health, and sports sectors in different countries.
In 2023, Programs from 3 countries were selected from among 11 applications to receive targeted technical assistance. In the Bahamas, efforts are underway to ensure that students have access to healthy products in and around their schools. In Belize, drinking fountains have been installed in schools to promote water consumption, accompanied by targeted campaigns aimed at students. In Colombia, physical activity is being encouraged through inclusive and recreational programs inside and outside the classroom.
Cuando los estudiantes se alimentan de manera saludable, se mueven más, mejora su atención y su participación en clase.
Me gusta que todos participemos y ninguno quede afuera.
We are generating evidence and recommendations that can be applied at the regional level.
Healthy school environments are a right and an achievable reality, which is why we support the strengthening of public policy that benefit the students in the Americas.
OAS and PAHO Hemispheric Program, a first line of action in the fight against non-communicable diseases in the Americas.
Muchas gracias. Y bueno,
Thank
ahora
you
vamos
very
a
much.
pasar
And
a
now
la
we will go
presentación,
to a
con un poco más de
presentation
detalles
with a
sobre
little more
este proceso
detail
de
about this
desarrollo
process
de elaboración
on
y
this
implementación
preparation of the
políticas
regional
de alimentación
guidelines on
saludable
the
y
policies
actividad
of
física en
healthy
entornos escolares.
and
Para lo
the
cual le doy la
physical
palabra a
activity
Vanessa
on
García
the
Larsen,
school
quien es la jefa de
environments.
la
I want to
unidad de
give the
factores de
floor
riesgo
to
y
Vanessa
nutrición
Garcia
del
Larsen, Unit
Departamento de
Chief on
Enfermedades
Risk
No
Factors and
Transmisibles y
Nutrition
Salud Mental
of
de la
Department of
OPS.
Non-Communicable
Adelante, Vanessa.
Diseases and Mental Health of the PAHO. Vanessa, you have the floor.
Tu micrófono está apagado.
Your
Gracias.
microphone is muted, Vanessa.
Gracias, Leslie.
Thank you,
Muchísimas
Leslie.
gracias a
Thank you
todos
very
los
much to
participantes
everyone,
que
to the
nos unen
participants
aquí
that are
esta
joining
mañana.
us this morning.
Estoy muy agradecida del
I really
esfuerzo que
thank
ha
of the
significado esta
effort that
iniciativa.
has meant
Y
on this
voy a
initiative.
continuar en inglés para
I'm going to
balancear el uso
continue
de
in
ambos
English
idiomas.
to balance
I
the
am going
use of
to just
two
briefly outline the
languages.
development process that was behind the development of this regional guidance on healthy eating and physical activity policies in school settings. So to put this project into context, I'd like to remind us all of the plan of action for the prevention of obesity in children and adolescents for the period 2014-2019. And that's where the initial goal of halting the rise of the rapidly growing obesity epidemic in children and adolescents was highlighted so formally across the region. And this plan of action was structured around 5 proposed strategic lines of actions. First of all, primary health care and promotion of breastfeeding and healthy eating, improvement of school nutrition and physical activity environments, which is where this particular presentation is centered on, and our collaboration with OAS, fiscal policies and regulation of food marketing and labeling, various other multi-sectoral actions, because of course obesity is a societal challenge, surveillance, research, and evaluation. Now, what makes schools an ideal setting for these sort of interventions and plans is that they represent a unique platform to improve health and nutrition of children. To start with, children are, of course, spending 6 to 8 hours a day at schools, and therefore this is a really ideal enabler to implement platforms where they're going to ensure that they are exposed to these sort of initiatives on a regular basis, which is what we need to secure success. It is also an ideal opportunity to reach out not only to the school children, but also their families and their immediate community. Many schools also have various school feeding programs, and through this initiative, we can identify ways to strengthen such school programs. The initiatives also allow sustainable and institutionalized interventions that can reach a large number of children. So from a public health point of view, they can be highly effective. And last but not least, they allow for the development of knowledge, attitudes, and life skills, as well as habits at a critical age to form these habits. So the hemispheric program on healthy food and physical activity policies in school environments is centered around three main pillars. First of all, healthy food school environments, promoting physical activity through schools, and also action frameworks for developing and implementing public food procurement and service policies for a healthy diet. And this is what we have taken into account to develop action areas for technical assistance and exchange. There are three main components to the hemispheric program, and they are encapsulated into research components, professional development, and educational resources, and also technical assistance and exchange program, as I said before. And here we've itemized what are the critical elements within each of those. So for example, for the research component, there is an inventory of existing research and research institutions in related areas within the region, implemented programs of monitoring and evaluation, publication on priority topics identified within the hemispheric program implementation. For professional development and educational resources, there is a regional distance course for teachers and school administrators, the hemispheric program on healthy food and physical activity policies in school environments. There is also a virtual hub for policies, guidelines, and tools on healthy food and physical activity policies in school environments, and video and media series on healthy foods and physical activity. Now, my colleague Jesus already mentioned that we work with 3 countries in this initial phase for the documentation of country experiences of technical assistance. And this was carried out over a period of 2 years. We worked with Bahamas, Belize, and Colombia. Each of them focused on a specific main action area. So, for example, Bahamas had school food environments, as briefly illustrated in the video you've all just seen. And the key results were around production of a manual for healthy cooking and also the engagement of vendors of food, which are often an important part of the community for the access of food. Belize worked on the reduction of sugar-sweetened beverages and increase of water consumption, so water fountains, educational material, and monitoring systems were the key results that were produced by this country. And Colombia developed a program centered around physical activity promotion that included not only education within the classroom, but also intersectoral work with the community. And so here are some of the lessons learned from the systematization of technical cooperation experience between this 2-year period. First of all, the importance of cross-sectoral and intersectoral partnerships and clearly defined roles. Whenever we tackle the challenge that obesity represents, we learned more and more about the importance of including community, civil society, educational sector, the ministries of health, and the experience we've had with these 3 countries clearly shows that. There is also a need to institutionalize actions and integrate them to the school curriculum, and the relevance of community participation and also political leadership. And so we've identified some common enabling factors as well as challenges. And amongst the common enabling factors, existing policy and regulatory frameworks are extremely important, as well as multi-sectoral coordination and formal agreements between ministries. Of course, as I said, there are challenges, and some of the main challenges so far are financial sustainability. Obesity and overweight can be long-term conditions, and any attempt to address them need to also have solutions that take into account long-term sustainability. And this includes, of course, the feasibility of maintaining the interventions over long periods of time. And of course, we need to adapt the cultural environments and the cultural reality of the communities where these interventions are going to be implemented. And we need to consider inequities in infrastructure. And this is a very brief timeline that just illustrates the amount of of work and preparation that goes into generating the results that we are going to discuss today. So this is a 4-year work that has been carried out in close partnership with us, with the country selected. And you can see here, we started in 2022 with the launching of the Inter-American program. And then shortly after that, in 2023, OAS and PAHO formally launched the call for project proposals from countries interested in receiving intensified technical assistance to create school environments that were conducive to healthy eating, nutrition, and physical activity. And as Jesus mentioned, there were 11 project proposals received from member states, from various ministries of education and ministries of health, and they all underwent very careful technical review and evaluation by a PAHO selection committee. And this is how we eventually had Bahamas, Belize, and Colombia as the selected countries to receive intensified technical assistance for the project. And this is a more detailed plan of what has been happening over the last 12 months. And for those of you who might be interested in replicating some of the results that we are going to discuss here, or if you're interested in developing new platforms for the implementation of public health strategies to promote healthier eating and physical activity in school environments, perhaps this can help you. In April 2025, we initiated the preparation of the systematization proposal, including tools, concept notes, and workshop agendas. And we had the first meeting with the 3 selected countries where we reviewed the proposals and tools and also examined the validity of the methodological approaches that were going to be used in each case. And shortly after, there was national surveys and workshops for the implementation of the initiatives, and this is where we collected data. Each country collected data that was going to be part of the examination of the results afterwards. And in June 2025, there was a submission of the final version of the systematization report for validation by all 3 countries. And then after that, we held a number of virtual dialogues where progress was presented, and there was a continued technical support from PAHO colleagues to each of the 3 countries. And we also, of course, engaged in consultations with our partners at OAS to advance the implementation and the progress of each of the proposals in these countries. And then in November, between November 2025 and now, there was the production of the regional guidelines. And there was a draft, of course, that was discussed and reviewed by technical counterparts here at PAHO and also at OAS. And we've arrived now in July with the publication of the regional guidance on health eating and physical activity policies in school. So this has been a very exciting project that demonstrates how we've engaged multi-sectoral partners in 3 pivotal countries that are doing incredible work to advance the agenda to halt the increase on obesity. So we have the publication now, it's ready. And I look forward to discussing the experiences and the impact that this is going to have in the countries that are participating and perhaps more broadly in the region. Thank you.
Muchísimas gracias, Vanessa, por darnos esta explicación mucho más detallada.
Thank you very much, Vanessa, for providing this very detailed explanation on this process that has also allowed feedback and participation of ministries of health and ministries of education beyond the 3 countries that received targeted technical assistance. And now I'm going to present the regional guidelines regarding the more detailed structure of the document. However, I would also like to say that we invite you to download the document and review it, read it, because it has many more details than what I will be able to share in this presentation. Can you please confirm if you can see my presentation?
que sí se ve,
Sí,
¿verdad?
sí, Leslie.
I think you
Perfecto,
can see it, right?
gracias.
Yes, Leslie. We can see.
Bueno, para quienes se acaban de
Okay, so
conectar,
for
mi nombre
those
es
that
Leslie
just
Bejar, soy
connected,
oficial
my name
técnico
is
en
Leslie
nutrición y
Bejar.
sistemas
I'm
alimentarios
a technical
de la Oficina
official
Regional de
in
la Organización Panamericana de la
nutrition
Salud. Y
at
aunque en esta
Tahoe,
ocasión yo les estoy
and
presentando este
during this
documento de los lineamientos
today I will
regionales, ha
be
sido un trabajo
presenting
en
this
equipo
document
de
with the
colegas de
regional
la
guidelines, but
Organización
this has
Panamericana de la
been
Salud, de la
work
Organización de
done
Estados
with
Americanos, de los tres
WHO,
países que recibieron
OAS, and the
asistencia
three
técnica
countries that
personalizada, que
receive
son Bahamas,
targeted
Belice
technical
y
assistance,
Colombia,
which are
así
Bahamas, Belize,
como
and Colombia,
de varios
as
de
well
los
as
Estados miembros, tanto
the
ministerios
member
de salud como
states,
ministerios de
ministries of health,
educación
as well
de
as
nuestra
ministries of
región, quienes
education from a
amablemente nos
region
dieron su
who have
retroalimentación sobre
kindly
este
provided
documento.
their feedback on this
Y
document.
pues bien, el contenido de
And
esta
so
presentación
this
básicamente abordará sobre darles
presentation
un poco más
will
amplia explicación sobre qué son estos
will provide
lineamientos,
a
para qué
larger
son, cuál
explanation
es su
on what are these
objetivo,
guidelines, what
cuál
are
es la
they
estructura de
for,
este
what is their
documento,
objective, what is the
ahondar un
structure
poco
of this
más en
document,
estas
and
tres
then
áreas de
deepen
política que
in
se
these three
abordan,
policy
como
areas, as well as
orientaciones para su implementación, y cerraré
orientations
con
for
unos
its
mensajes clave
implementation.
que me
And I will
gustaría
close
que
with some
se
key
quedaran con
messages
de este
that I would
documento,
like
¿no?
to leave with you from this document.
Pues bueno,
Okay,
comenzar,
so
¿no? Recalcar, creo que
I would like
todos en nuestras
to
intervenciones hemos hablado
remind,
de la
I would like to say
importancia
that
de
in our
confiar
interventions,
en
we
las
have all
escuelas,
talked
¿no? Y
about why it is so important
no
to
es
act in
un
schools.
secreto
And
que
it's no
tenemos
secret
prevalencias
that we
sumamente
have
altas, tanto de
very
sobrepeso
high
como de obesidad en nuestra
prevalences of
región para
obesity and
niñas,
overweight
niños,
in a region
adolescentes.
for girls,
Y
boys, and
si no
adolescents.
hacemos nada,
And if we don't do
2030
anything
estas
in
prevalencias
2030,
podrían todavía aumentar mucho
this
más
prevalence
según
could
estudios de
increase
modelaje
even more
en
according to
nuestra
modeling
región.
studies that have been done in our region.
Y en cuanto a actividad
And
física,
regarding
también
physical
tenemos una
activity,
altísima
we also
prevalencia
have
de
a very high
inactividad infantil.
prevalence of
Adolescentes,
physical
más del
inactivity.
80% de
More than
adolescentes
80%
no
of
cumplen con las
adolescents do
indicaciones
not
mínimas de
comply
actividad
with the
física. Recordemos
minimal
que las
recommendations regarding
recomendaciones
physical
de la
activity.
Organización Mundial
Let's
de la
remember
Salud
that
para
the
actividad física son de
WHO
al menos
recommendations for physical
60
activity are at
minutos
least 60
diarios de
minutes
actividad
every
física de
day,
moderada a intensa
from
durante la
moderate
semana
to
para niñas,
intense
niños y
physical activity
adolescentes. Sin
for
embargo,
girls,
pues aquí
boys, and
podemos ver,
adolescents.
y esto
Here we
es
can see,
prácticamente en todas
and
las
this is
regiones, es decir, no hay
practically
ni un solo
in
país que
all
esté
regions, there is
por o que
no
alcance
country
estas recomendaciones.
that reaches these
Pero además,
recommendations, but
importante destacar cómo
beyond
esta
that, it's
enorme
important to
brecha de género que
highlight
tenemos
the
hoy.
huge
Las
gender gap
niñas
that we
son
have.
mucho más
Girls
físicamente
are
inactivas, con
much
86.4%
more
de
physically
prevalencia,
inactive with
comparada con los
84.4
niños y
prevalence,
adolescentes que
and boys and
llegan casi al
adolescents reached
75% de prevalencia. Y esto
75.2%.
nos invita a
And
que
this
revisemos
invites
o
us
que este
to
documento lo
review,
apliquemos
or
y lo
this document has to
implementemos
be
también
applied
con
and
esta mirada,
implemented
con esta perspectiva
with this
de
vision
que
and this
niñas
perspective.
versus niños
Girls
tienen barreras distintas
versus
para
boys have
realizar
different
actividad física.
barriers to
Y
perform
bueno,
physical
además,
activity.
como ya habían comentado, la
And as
escuela entonces
we
es un
had
espacio que
commented,
se vuelve
the school
estratégico para
is a
revertir
space that
estas
is
tendencias de
strategic
sobrepeso,
to
obesidad e
revert these
inactividad
trends
física,
regarding
porque
overweight,
confluyen factores
obesity,
muy
and
relevantes
physical
como son
inactivity because
la
we have
educación,
very
la
different
salud y la conectividad.
factors here like
Y los
education,
contenidos
health, and
la
community.
capacidad de impactar millones
And
de
we have
niñas,
the
niños y
capacity to
adolescentes
impact
de una
millions
forma mucho
of
más
girls,
sostenida
boys, and
y
adolescents in a
equitativa.
more sustained and
Y
equitable
bueno,
manner.
no voy a entrar en detalle
I'm
en,
not going to go
en esta
into
gráfica,
detail
pero
in this
aquí les
graph,
dejo la
but
publicación,
I'm going to
pero
leave you the
simplemente sí quisiera
publication here.
comentar y
But I
mencionar
would like
que
to
se
comment
hizo esta
that
evaluación de las iniciativas de
we did
alimentación, de
this
nutrición y de actividad física en las
review
escuelas de
regarding the
la región
initiatives
y
in
de
the
los
school in the
países
region,
29
and in the countries,
presentaron su
29
política o
countries
programa
showed that
o
there was
norma sobre salud y
a
nutrición
policy
escolar.
program
Los
nutrition
objetivos más
on health
comunes
and
se
nutrition.
manifestaban
The
estaban
most common
relacionados con
objectives
promoción de
were
estilos
related
saludables,
with
con educación
promoting
en salud
healthy
y
lifestyles,
nutrición,
with
con
education in
asistencia
health and
escolar
nutrition,
o
uh,
pedagógica,
pedagogic
impactos en
assistance,
el desempeño académico
impacts
o
in
intervenciones en
academic
inseguridad
performance,
alimentar.
or interventions
Sin
in food
embargo,
insecurity.
solamente, por ejemplo, aquí podemos ver que
However,
45 de estos
only
países contaban con
45
normas
of the
de,
countries
para regular la
had
publicidad
norms
y
to
la promoción de
regulate
alimentos y bebidas
publicity and the provision of food and beverages in schools. And among them, 23 countries had norms on nutrition, on school nutrition. So this shows us that the overview that we have in the region, and so there is still a lot of work to do or to improve in our countries. And now, if we talk about these guidelines, what is this document? This document is a technical and operational guide that has been developed by PAHO and OAS in the framework of the Hemispheric Program to support the countries in the Americas in certain specific matters, like, for example, the design of intersectoral programs and policies, like, for example, having the participation of ministries of health, ministries of education, and other ministries that could be involved, as well as the implementation of healthy school environments, being able to monitor and assess the progress to prevent malnutrition in its different ways. So, in a nutshell, this document combines three dimensions: technical capacity, management capacity, and governance capacity. And everything has to be oriented so that school healthy policies are effective, measurable, and sustainable throughout time. And well, regarding the specific objectives of these guidelines, they are strengthening institutional capacities for ministries of health and ministries of education, as well as other key sectors, to move forward in the development and the strengthening of national policies that will allow us to transform school environments so that they become spaces that promote healthy food and physical activity. Another objective of these guidelines is to offer conceptual frameworks, methodological frameworks, and normative frameworks that are global, regional, that are based in scientific evidence and in good practices, so that they can help us formulate programs and effective and sustainable policies, and also provide technical criteria for the design and for the strengthening of those that already have some program or some policy, and also for their action plans and monitoring and assessment systems, which will include, as we will see further on, basic indicators to be able to do follow-up, to assess the progress of these policies and programs, and also to promote intersectoral articulation and the participation of key players in the government sector, as well as in the school sector and community sectors, because they constitute the main audience of these guidelines, and they have a fundamental and critical role in strengthening healthy school systems. And last but not least, it is important to facilitate the adaptation, the contextualized adaptation of guidelines to national realities, promoting approaches that are centered in rights, cultural pertinence, equity, and sustainability. And these guidelines are aimed at decision makers from ministries of health, ministries of education, sectors that are related at a national and a local level. But it's also aimed at the educational community, teachers, principals, training institutions, and pedagogic teams, and civil society that has an important role in terms of accompaniment and in terms of surveillance and advocacy, and the academia, of course, because these are instances that provide support as well as technical cooperation. These guidelines use 5 guiding principles. In the first place, we have an intersectorial approach, which means that the programs and the policy to promote healthy nutrition and physical activity must be built jointly, and these are going to require the articulate action of multiple sectors to guarantee interventions that are coherent, coordinated, and sustainable. And as I mentioned, we have sectors such as health, education, sports, agriculture, social protection, transportation, finance, and among others. The second guiding principle is active participation, which means including key players like teaching associations, mothers and fathers, students, municipalities, localities, that in this framework, school has to be acknowledged as a space of collective learning, and these participation instances can also be translated into pedagogic projects, but also community projects. The third guiding principle is equity and rights approach. Right to healthy nutrition and health. And this principle acknowledges that inequality we are not getting any sound that will impact in a differentiated manner the students, as well as demographic features, socioeconomic conditions, ethnia, geographical zone, etc. So what we seek is to reduce structural gaps in terms of health, nutrition, and development opportunities. The fourth guiding principle is to base this on evidence. Recommendations and strategies that are proposed in this document are supported and available scientific evidence, as well as in the good practices that documented at a global level and regional level. We also seek to encourage authorities to share their experiences on how they integrate nutrition and physical activity in the curriculum or in the school environment, and also on the impacts that this has on learning and the school life in general. And then the last guiding principle is cultural and territorial pertinence. In this document is not written on stone. We seek to promote adaptation to the local context, acknowledging that we have a huge diversity in a region and also a huge diversity regarding the environment. And this has to be adapted to the political context of all the territories of our region. This means valuing knowledge and local nutrition practices so that this is not lost. And in a nutshell, the document is structured in 6 main areas. So first, there is an analysis of the regional situation. There's the regional framework and the evidence that I have talked about. And now I would like to go to the public policy design or programs to promote healthy nutrition and physical activity in school environments. The development of public policies and programs for the promotion of healthy nutrition and physical activity needs a planified, structured, and participative approach. These guidelines offer reference framework that each country will be able to adapt according to its reality, its specific context, and the priorities that they have, and also according to its development plans. The methodological process that is proposed in this document seeks to facilitate spaces for dialogue and articulation between the key players that I have mentioned so that they can support member states in moving forward using political will and towards the effective implementation based on evidence or evidence-based. And these are the 5 recommended stages for the design, implementation, and sustainability process for public policies or programs that are aimed at promoting healthy environments. So first of all, we have the creation of a multidisciplinary team, the diagnosis and situational analysis, the formulation of the work plan and for the system of implementation, the implementation of the policies, and very importantly, the monitoring and assessment. And now, for formulation of the work plan. This plan must be integrated coherently, considering 3 fundamental components. First of all, the design or the review of the public policy or the programs, then the operational program or implementation program, and then the monitoring and assessment system. These are the 3 fundamental components that must be considered when it comes to formulating this work plan. So these elements, so we encourage you to align this with international rights frameworks and recommendations established by PAHO and WHO, and we also recommend to use a cycle life approach and a human rights approach, especially taking into consideration children's rights. And then have these 4 important steps or areas when it comes to formulation. And so it's also about defining general specific objectives, having transversal principles, and having action areas in these specific areas that I will talk about more specifically, that I will talk about later on. These are the policy areas that we divide into 3 great areas. The first area refers to healthy school environments and food environments, and we know that we need to have a normative framework that will regulate the offer, the promotion, the publicity, sponsoring, and the availability of food and beverages in and around the schools. And one of the most effective strategies to reduce access to ultra-processed foods is the implementation of nutritional criteria based on the nutrient profile model from PAHO that establishes cut points to identify excessive amounts of critical nutrients like sugars, other sweeteners, total fats, saturated fats, trans fats, and sodium. And here, the role of the national health authorities have to develop and improve these regulatory frameworks to regulate the offer, the availability of food and beverages inside and around schools, as well as establish mechanisms to surveil and sanction and make sure that these are aligned to best practices and international recommendations. And among these initiatives, or in this regulatory framework, it is also important to have guidelines regarding the food that can or cannot be sold inside or outside the schools. This must be mandatory for suppliers, concessionaires, or school food programs, and this must also be aligned to the PAHO nutrient program and to guides from each of your countries. And another important relevant point are school food programs, like for example, universal school foods that are universal and free. And this policy guarantees nourishing good quality food for all students. And last but not least, pedagogic projects, like for example, gardens, food fairs where girls and boys are taught on cooking skills so that they can cook basic things and so that they can help at home. They must also, these pedagogic strategies have also to be supported on methodologies that are participative so that the students can put into practice the knowledge that they're getting at school. And the way through which we can facilitate this is by articulating it in the school curriculum and also orient teachers. And also, teachers must provide orientation so that there's continuity and so that this is integrated in the pedagogic process. And well, it is also important to say that school environments can and must become strengthened with sustainable production initiatives, like, for example, alliances with local producers. And precisely, the second area speaks about the purchases and services for a healthy diet. So policies should be oriented towards health and should prioritize the nutritional quality as well as the sustainability of the local food system. And in this sense, buying publicly and for small producer is going to be a strategic method that will guarantee healthy diets, but it also will promote the economic development of communities. And these specifications for the purchase of food, and the offer of food inside the school should prioritize food that is not processed, that is culturally adapted, that is fresh, and that is aligned with the nutrient profile by PAHO and also with national food guides. It is also important to consider here to diversify menus so that they not only strengthen the nutritional values, but also strengthen the cultural belongings. And these policies must also include criteria to reduce waste, food waste. And it is important in this point, and as I have mentioned before, to have active coordination with other ministries, not only ministries of health and education, but also agriculture and finance ministries, with the aim of ensuring joint planning of the school menu, food purchase, budget allocations, and logistics. And the third area of these recommended policies and these guidelines is the promotion of physical activity. Schools and school environments should promote physical daily activities for girls, boys, and adolescents to contribute with having more active societies. Our school environments have to promote opportunities that are safe, inclusive, and agreeable to carry out physical activity inside and outside the school hours. And for this, we need to have structural approaches and educational approaches that position physical activity as a fundamental component of childhood and adolescent development. I had said that girls, boys, and adolescents should carry out at least 60 minutes of physical activity during the week. However, the implementation should start by guaranteeing in the school curriculum to have regular classes and quality classes in terms of physical education with 120 minutes per week. And in this recommendation package, to be able to incentivize physical education practices, We have what we commented on, having quality physical activity, the active deployment that will encourage walking or using bikes to go to school or to come back from school, having physical activity opportunities before and after the school day, like club sports or supervised free playing spaces, then having physical activity opportunities during breaks, and also including games and structured activities that will increase and incentivize movement and have active pauses in the methodologies of learning and physical activity for people with special needs to guarantee adaptations and have the participation for all students, including people with specific health conditions.
El documento también habla una parte de participación y gobernanza
This
para
document
poder
also has a part of participation and governance to have the success and sustainability of policies and programs for environments, school environments that are successful. This depends on having a strong governance, but also on the inclusive and structured participation of all stakeholders involved. This implies a collaborative model that coordinates the roles of the government, educational communities, civil societies, academia, multilateral organization. And we have seen it in this experience, in this regional experience of systematization that will be speaking about in more detail Belize and Colombia on how through these governance mechanisms we had achieve a better result in the implementation of these programs, but also on monitoring, shared responsibility, and social mobilization. And I would like here to highlight that it is one of the most important steps is the monitoring and the assessment that must be articulated with the national systems that exist. And in this document, we give some other tools and resources to be able to have this monitoring and assessment. And what we have to look for is to have indicators of process and intermediate results, as well as impact indicators. And to finish this presentation, I would like to emphasize or just give you 4 key messages in the first place. Remember that this is a flexible tool, it's not a unique model, and that every country will adapt these guidelines to their own realities. On the other hand, to emphasize that teaching without regulation is not enough. Both dimensions must be activated together. Intersectionality is the condition that would enable it, and no, without articulation between health, education, and sports and other sectors, the impact are fragmented and not sustainable. And the regional experiences are transferable. We include the experiences of 3 countries that we have been giving technical assistance with whom we had the exchange of experiences, barriers, and challenges. But it is important to document experiences that we have with other countries, with other member states. And on my behalf, this is all. Thank you very much. Let's go now to a panel. I stopped sharing my presentation, right?
So now we're going to switch to a panel of the multisectoral coordination of the experience of Belize and Colombia. Unluckily, Bahamas couldn't participate today, but Belize and Colombia, they are going to share their considerations for the dissemination and implementation of these regional guidance. And to moderate this panel, I want to welcome Audrey Morris, who is the advisor on food and nutrition at PAHO. Over to you, Audrey.
Okay, thank you so very much, Leslie. So, as mentioned, this panel is going to be on multi-sectoral coordination. We have the experiences of Belize and Colombia and their considerations for dissemination and implementation of the regional guidance. First, we'll have the presentation from Belize, and the participants today will be Kathleen Juan. She's a school feeding coordinator at the Ministry of Education, Culture, Science, and Technology for Belize. And the Ministry of Health counterpart is Robin Daly, nutritionist at the Ministry of Health and Wellness. So over to you, please.
Good morning. Thank you so much. I'll be sharing my presentation. My name is Kathleen Juan, and I am presenting on behalf of the Ministry of Education today. Confirming you can see my presentation?
Yes, we do.
Great. So thank you, everybody, and thank you for allowing Belize to be part of this 2-year process. As mentioned, this has been going on for quite some time, and I think the project has evolved over that time. And so I'm happy to share what we have gotten done through this project and what we've learned from it. So I'd like to give everybody some context for the Belize project. So as I see, we have quite a global audience today. Belize is a small country located in Central America. We have approximately 410,000 people, and 30% of the population are children under the age of 14. We have a very high child poverty rate, and that is directly linked to food and nutrition intake, as there is a dietary basket that is considered in the poverty assessment. So we know that our children do have issues with nutrition, which is also reflected in the recent 2024 multiple indicator cluster survey, which included children 5 to 9. As we have historically high rates of stunting, but we are also now finding alarmingly rising rates of overweight and obesity in our children, which is actually seen in most of the Caribbean area as well. We have done some data collection in the Ministry of Education, and we have found very high rates of unhealthy food and sugar sweetened beverage consumption. As high as 94% of our children are reporting that they've had at least one sugar sweetened beverage in the last 24 hours. This project was done within the National Healthy Start School Feeding Program, which is managed by the Ministry of Education. And it is a meal program, a free meal program, and we emphasize a healthy meal. Currently, we are working in 78 schools nationally, with 15,800 students being provided a daily meal. And recently, last year, we released and got cabinet approval for our Belize school food and nutrition policy. And this is a multifactorial policy. It's looking at creating healthy school food environments. And to give some context particularly for Belizean schools, I think like many in the region, most of our schools were actually constructed 50 years ago or more. And at the time of construction, there really wasn't any consideration for water access for the children. And so what we see in the majority of our schools is water access is a pipe. It could be a hand pump outside. It could be a sink or just a pipe outside. This is just tap water, room temperature. Most of our schools also struggle with any sort of equipment. And so in Belize, a lot of schools got donations from companies, branded refrigerators, and that is where the company's products are kept, but they are not allowed to store anything else in those refrigerators except for company products. And they might not have the funds to buy their own equipment for their school. So with this project, our initial problem that we looked at was that we have very high consumption rates of sugar sweetened beverages, and we are seeing rising rates of overweight and obesity with our children coexisting with micronutrient deficiencies. So our goal is to promote healthy choices on school campuses, and we need an alternative for sugar sweetened beverages, which is free cold filtered water. And so we took a very practical approach and looked at a multi-phase intervention testing two models of water provision. One is a water fountain, and one is water coolers that use the 5-gallon refills. This was a collaborative effort between the Ministry of Education, Culture, Science, and Technology and the Ministry of Health and Wellness. And it was, as I mentioned, managed under the National Healthy Start Feeding Program with the technical assistance from PAHO Belize for our educational materials and for the procurement done under this program. So in the first phase was really our comparative design. We wanted to see which worked better in our schools. Was it the coolers with the 5-gallon refills, which is a much lower implementation cost when you first start just to buy a cooler, versus a actual fountain with a filter and cooling system, which is an in-wall unit and a much higher cost to initially install. And also, going back to the infrastructure of the schools, more difficult to put into schools because many schools don't have space for the amount of equipment that is required for these water fountain systems. And so we wanted to look and see what's going to work better for our particular context in Belize. So the first design, we had one fountain, water fountain was installed in an urban school, which was very much struggling with sugar sweetened beverages because they have vendors right at their gates that were selling sugar sweetened beverages. And then we distributed 30 water coolers nationally to different schools in the feeding program. And then we surveyed them to find out which was more effective. And we quickly found that, and I will go more into the details, what we learned from the surveys was that the fountain was actually the better option for the schools. So once we discovered that fountains were more the better option, we decided to do an expansion and install fountains into rural schools because we need to have some information about the costs for installing water fountains in different contexts. In Belize, we have town water systems, but many of our rural schools are working on wells, and that changes the cost of installation for water systems quite significantly. So all in all, under this project, we were able to have 4 water fountains installed, impacting a total of 1,900 students. And 30 water coolers were distributed, impacting approximately 3,000 students. And as you can see, these are really nice water fountains. They are modern, and the students really enjoyed using them. Along with the fountains, we also did some educational resources. So our participating schools received pamphlets promoting water. They received posters, banners, and we actually designed some logos with the input of the children. So we had some logos, and we asked the children to vote on their favorites, and these were the top 3 from our schools that they enjoyed to promote water. And these were printed onto stickers and distributed to the children. And also we gave all of the children in the schools with water fountains, they got a water bottle, a plastic water bottle, reusable, and it had these stickers on it to kind of raise the excitement of using their new fountain. So you can see an example of the water bottles that we distributed to the children. This is an example of the fountain that was installed and at one of the schools, and you can see the children were easily able to access. They're right at child height, and they were located in an environment in the school where any student could access the fountains at any time. We did some small group of focal We did some small group focal question work with the children, and we found from that there was a clear preference for cold water, and the children indicated in those sessions that it could be a alternative to sugar sweetened beverages in their opinion. If they had access to cold free water, that this would actually be something that they would consider instead of buying a sugar sweetened beverage. And we actually then had to go back, and the first water fountain that was installed did not have a cooler on it. So then that was retroactively installed. And going forward, all of the water fountains had coolers on them because of that result. And you can see here in this picture, this is the type of water cooler that I am referencing. So it is plugged in, it is electric, and it has cold water available for the children, the coolers. We then surveyed all of the schools, and particularly the staff at the school, to find out more about the accessibility and availability of water fountains versus water coolers. And what we found was there was a difference between accessibility and availability with the two formats. The water fountains provided continual access to drinking water to the students, to the whole student body, whereas the water coolers were empty or unavailable. And that might have something to do with either the location where they are put, because they had to be plugged in. They might have been in an office or classroom that the students could not access all the time. But the main problem was the administrative burden with refilling 5-gallon water bottles, because especially in large student populations, one class could fill up their water bottles and the entire water bottle would be empty and it would have to be refilled. This created a large administrative burden for the schools, and they just weren't able to keep up with it. So what we found was that 79% of the school staff reported water fountains became the primary source of drinking water for the students. But in the water cooler schools, only 28% of the staff reported that the water coolers were the primary source of drinking water for the children. So we saw a very clear difference in these two modalities. We also saw a clear difference between schools that were higher resources with the coolers and lower resources. There are some schools where their administration is much more active, and they were able to design a system to refill the water coolers and keep them well filled and just on top of things. But that was not the case in all of our schools, especially schools who had a much smaller staff. And so it was a significant burden for the schools. So what we learned from this experience is that infrastructure upgrades can result in increased water drinking and behavioral change. And for our students, temperature matters. They really want the cold water option. Now, Belize is a tropical country. We have very high temperatures. And I mean, it's true across the board. Adults would feel the same. They're going to want the cold option. We did see water fountains were a clear leader for improved water access and availability and use of the students. However, the cost of installation is quite significantly higher than water coolers. With the water coolers, we saw that the accessibility depended on the placement and that there was high administrative burden. Now, we did long-term monitoring, so 6 months or more, and we compared the cost with the two. Interestingly, not looking at installation cost, water fountains actually are cheaper over the long term in comparison to constantly refilling the filtered water. However, there is a very significant difference with the installation, and most of our schools could not afford to install a water fountain versus our schools could afford potentially water coolers. So that is something that is a very big issue for us in our schools, the sustainability of the funding, not only to install a fountain or a cooler, but then to maintain that. Water fountains have filters and so on that have to be changed on a regular basis, and there's a cost to that, whereas water coolers, you have to be continually buying water and filling those. So our recommendations, we have supportive policy. Belize has a school food and nutrition policy, and we have a cabinet agreement on sugar, sweet, and beverage bans. But in all practicality, the policies cannot be implemented unless the infrastructure is there to support the policies. And therefore, if we are promoting water as a drink of choice in schools, water has to be free and easily accessible to the students in the school. And we saw there is a high cost of implementation, so we have to have multi-sectoral support. We have to have ongoing budget allocation in order to expand and sustain this initiative in Belize. Thank you very much.
Thank you so very much for that presentation. And Kathleen, we'll get back to you with a follow-up question. But first, we're going to have the presentation from Colombia. So from Colombia, we have online today Yolanda Sandoval, who's the coordinator of cardiometabolic and other chronic conditions group at the Ministry of Health and Social Protection. And we also have Catalina Abanza, physical activity consultant at the Ministry of Health. So I will invite you now to make your presentation.
Muchísimas gracias. Buenos días para
Thank you
todos.
very much. Good morning,
En este
everyone.
espacio tan
Thank you
interesante.
for giving us
Quería confirmar
this
si ustedes
very
hacen la
interesting
presentación o
space.
comparto yo la
Let
presentación.
me share this presentation.
Adelante, Catalina.
Go ahead, Catalina.
Ok. Creo que la está. Ok. Ok. Ya la voy a poner en presentación. La idea es compartir.
Okay, let me put it on a presentation mode. The idea is to share.
Bien, entonces en esta mañana les vamos a
This
contar desde
morning, we
Colombia
will tell you from Colombia
el programa hemisférico sobre
what is the
políticas
hemispheric
de
program
saludable y
on healthy
actividad física en
food
entornos
and physical
escolares.
activity in
Este
school
proyecto fue
environment.
desarrollado de manera
This
interministerial
project was
a través
interministerial
del Ministerio de Educación
through the Ministry of
Nacional, el Ministerio
National
de
Ministry of
Deporte y el
Education and
Ministerio de
Sports,
Salud de manera
the
conjunta
and
en el
the
marco del
Ministry of
programa
Health,
hemisférico sobre políticas de
and the
alimentación
framework
saludable
of the
en
hemispheric
entornos
program
escolares
on
desde la
healthy food
OPS
policies and
y
physical
la
activity
Organización de
in
Estados
school
Americanos.
environment
¿Cómo
on
llegamos
PAHO and OAS. How
a
did
este
we reach
proyecto? De manera
this context?
sectorial en Colombia, teníamos una
In
comisión
Colombia, we
intersectorial
had an
de
intersectorial
promoción y fomento
commission
de la actividad
on
física
promotion and
convoca
furthering of physical
cultura de varios
activity
ministerios a organizar apuestas intersectoriales
that did have
nacional
both
de beneficio.
ministries doing some intersectorial
Nuestro
work.
proyecto, como lo pueden ver
Our
en la
project,
lámina,
as you can
entonces
see
estaba
here, that
relacionado con
was
el
related
cambio de actitudes y
with
comportamientos
the change
en
of attitudes
adolescentes
and
entre los 6
behavior
y 7 años en
between
entornos educativos
the
escolares
children and
frente a la
adolescents
realización de
from 13
actividad
to
física.
17 years,
Escogimos
confronting
esta población de
the
adolescentes
physical
porque es los que
activity in
tienen
this
el no
population. We
cumplimiento
have
de
chosen
recomendaciones
that
en
as
actividad física
this
en Colombia
age
y además
stage because
nos
it's the ones that have the
localizamos
least
en
for
una región
follow-up
del
of
país
the
en donde
activity
encuestas preelectorales nos
needs
hablan, que
in
es donde
Colombia.
el
So that
cumplimiento
is why we
bajo.
thought
Esta región de
that
Colombia se llama la zona cafetera y hace
we
parte de
have
unos
in a
departamentos
coffee
específicos del
area
país.
and some
Y también
specific
queríamos
departments we
tratar de
have
mirar
this
cómo
problem,
era
and we
este
wanted to
abordaje
see
con una
how we could
característica
have
interseccional
these
particular y
intersectorial
además
characteristic
del curso de vida
that
en adolescentes
and
pudiera
these
convocar era entornos educativos de
could
áreas
have
rurales. Entonces,
educational
así nos
environments
fuimos
that
con
would
nuestro
not only be
proyecto. Esto,
urban but
este
also rural.
proyecto inició con una
This is then
aproximación en
I've
una
had an approach
institución educativa
in
del
an
departamento del Quindío
educational
rural que contaba con la
um,
población y después
environment and
al
Boquia
abordaje de
Quindío department, that is a rural department.
extendimos a otros departamentos
And we then
y
went
Caldas
to
de
other
departamentos
the departments of Caldas and Caldas, that is
abordamos
the
todas las
ONP
instituciones
department,
educativas
where we had
rurales y
all
de
the
manera
rural
importante como un
educational
hallazgo y una barrera se
establishments,
nos presentó que no
finding
podía
the
acceder a
uh,
una institución
barrier
educativa
that we
temas
found
del conflicto
that
armado en
was the
Colombia. Entonces es
difficulties
algo
to
supremo
have
relevante
In Colombia, the possibility of having a recreation and physical activity that has facilitators that could help an intersectorial coordination, but also the need to have public we had a very important facilitators. We have national policies, sectorial, and on the sports and education and health that favored from the promotion of this school activity. And we had this more broader framework that called us in the development policy that go to in favor of the promotion of physical activity and educational in schools, in the school environment. We wanted to put this promotion of physical activity, recreation, and taking advantage of the free time from the school environment and also be able to have this indirect benefits and the promotion of physical activity on the public health environment.
Sorry,
Continue.
Catalina, may I interrupt you for a minute?
no solo
I
económico
don't think she's
de la
hearing me.
asistencia técnica, sino un fortalecimiento financiero a través de la cooperación
We
técnica
need a financial
y
help
que
through
nos
technical
Continue.
cooperation.
en la formulación, el diseño y la
On
implementación,
the formulation, design, and
todo el proceso de
implementation,
diseño de
we
carácter
had all the
intersectorial
process under the intersectorial character,
que nos facilitara recopilar
a way
datos
in which it was
para
make easier
lograr
to
establecer
collect data,
una caracterización y
to
un
have
reconocimiento local de cuáles eran los
a local
oportunidades
acknowledgement of
y
what were
retos
the
para ayudar a
factors,
las
opportunities, and
actividades y
challenges
instituciones educativas
for the
y
education, for the schools,
ciertos tipos de capacidades y
and
formulación
certain types of
pedagógicas para el tema
capacities
de la actividad física
and
y
school environments
a
for
un
the
análisis de
physical activity issues.
nosotros desarrollamos esto en la
We
vigencia
developed
de
this
años largos,
on
2024,
these two
diseño,
long years, 2024,
y para
2025.
este
The design, the systematization, and the
26
results.
logramos generar el
And
diseño
we were able to
de
generate for
para hacer
2026.
la aplicación de la socialización de los resultados
We
del
were
proyecto.
able to generate the capacities and the
Este
socialization of
instrumento
the
que yo
results.
hablaba se
With
pudo
the
digitalizar
digital
para
instrument, we were able to
tener los resultados y para el año 2025
get the outcomes. I'm
también
sorry, for
ir a hacer las
2025,
visitas, trabajo de
we were
campo,
able to do
llegar a
the
estos
field work
territorios que son apartados de la capital de nuestro país. Nosotros
that we were be able
tendríamos que
to do
lograr
some
el
work.
I would like to interrupt for a minute, Catalina.
Aquí me
Okay.
dicen que tengo un poco de mal
Can you
audio,
hear
pero
me?
creo que ya cerré la cámara.
I can hear you. I closed my camera already.
Okay.
Does that improve?
There still seems to be a problem. I think we're going to try to let you stop your presentation at this point, and we will share from Kaho the presentation and see if that is any better.
Ok,
Because the
ya
sound,
dejo de compartir y tú
okay,
empiezas
right.
entonces a ver si la situación mejora.
Let's see if I don't share things that would get better.
Ok.
Okay, let's try to continue. Thanks.
Bien. Les hablaba de la
I
línea
was
del
telling you about the timeline.
esta línea del tiempo nos habla de cómo fue el proceso
That tells us
de
about the
implementación
implementation process.
2024, todo lo que fue el diseño del
2024,
instrumento.
the design of the tool.
2025, hacer una
25,
digitalización de
to do
este
a
instrumento
digitalization of this
y
tool
lograr hacer el
and
fortalecimiento
to
de
be able to
capacidades.
do the
Y en el
strengthening,
2026 planeamos ya hacer la
skills and ability strengthening, and to be able to generate
resultados del
capacities
proyecto.
and the results of the
Podemos
project for
avanzar a la
2026.
siguiente diapositiva. Dentro de los resultados que
And
esperamos,
what is expected
obtuvimos, habían unos
results?
resultados a
We
corto y
had the
mediano
short
plazo.
and medium
De
term
manera
results.
inmediata logramos
Immediately,
identificar
we were
de
able to
manera
identify
local en cada institución
and
educativa las
locally in every school
programas y prácticas que
the
facilitaban el
adherence of
fomento de la
students to
actividad
physical
física.
activity
De
and
ahí
the
tuvimos una
barriers that are
aproximación
difficult at
a
its
16 establecimientos
practices.
educativos,
And
la
this we
participación
had
de
in
alrededor de
16
500
schools
docentes, donde se incluían
where we had the
activos y de
inclusions
alrededor de 1000
of
estudiantes,
processes
en donde se incluían los estudiantes que eran los convocados
socializing the
del
strategies and
estudio
tools
de
that
13
would
a 17 años. El otro resultado inmediato
the
era
other
establecer
immediate
herramientas
result
pedagógicas, especialmente facilitar
was
el conocimiento y
the
divulgación de los
facilitation of
lineamientos que tiene a nivel nacional las
the
entidades de la
dissemination
nación de
of the
educación, deporte y salud
entities,
para la promoción
school,
de la
sports,
actividad
and health
física,
for the
lograrlos
physical
llevar a estos
activity to be
establecimientos
able to
para
reach
lograr su
these
armonización con las apuestas
establishments
que
to
tenían
harmonize this
y también de
and
resultados
to
intermedios
have
ya
intermediate
lograr el
results
diseño de ambientes
to
favorecedores,
achieve the
dar
design
estas
that
recomendaciones
would
que
favor
teníamos
these
y logramos también a
recommendations.
través de la cooperación técnica llevar unos kits deportivos para poder establecer herramientas que facilitaran la promoción. La siguiente. Y pues de todas maneras
And
seguir dándoles sostenibilidad a
continue
las propuestas a
giving
través de lo que reconoce
sustainability
el documento de política
through
de la
what the
OPS y a través de
policy
la
document
gobernanza, la articulación
recognizes through
intersectorial y
governance,
organizar todos los
intersectorial
procesos de acción
articulation, and
conjunta
organizing
entre
the
actores, sectores
joint
a través de
process
un liderazgo
actions through
compartido. Tenemos la
shared
siguiente.
leadership. Next, please.
Y tener en cuenta
And
estos elementos
taking
orientadores y
into
dejar
account these
plasmados a
orientation elements
estos 6 pilares, el
and use
fortalecimiento
these 6
de
pillars:
la acción intersectorial,
intersectorial action,
salutogénico, la gobernanza para la salud,
health governance,
la territorialidad, la innovación y
territoriality,
la acción
innovation,
comunitaria. Estamos
community
totalmente de
participation,
acuerdo con
and
el resultado de
soliciting
este
and health marketing.
que
We
necesitamos la
totally
suma de
agree.
esfuerzos, actores, sectores,
We need to
entidades, la
join
participación de la
efforts,
comunidad y un
players,
escalamiento
and
y un
community
reconocimiento de las
participation, and have and
particularidades
acknowledge
locales para lograr la sostenibilidad de los
local
proyectos.
specificities to achieve
La
sustainability.
siguiente, por favor.
Next, please. The sound that we are
Y
getting
llegar a
is
establecer
choppy,
una apropiación y un
and
involucramiento de
also
sectores entidades
establish an involvement
entidades
of
que
sectors and
podamos llevar a
entities
la
that we
sostenibilidad,
can
dar
take to
oportunidades de
sustainability
apoyo técnico que nos
and
han
have
permitido, nos han
technical
permitido
support that has
para
allowed
la
us
relevancia de
to.
la comunidad educativa
The
de estas
audio that we're getting is very
reportadas
choppy.
la
We cannot
calidad del
understand
país
what is being
y hacer
said,
esa incorporación sostenible.
and
La
then
siguiente,
have
por
that
favor.
sustainable incorporation.
Y pues finalmente
And
estamos
finally,
convencidos
we
desde los
are
sectores
convinced
participantes, no solo desde
from
salud, educación,
participating sectors,
deporte,
from health,
que de manera
education,
armónica
sports, and
vamos a poder
others,
lograr ser
that
más
we will be able to
dar
that we will be able
sostenibilidad a
to
nuestros
become
procesos
stronger
y lograr poder
and
documentar,
create
sistematizar y
sustainable
monitorear
processes
estas
and
apuestas
document, systematize, and
educativas
monitor
para el bienestar
these
y la calidad de vida
projects for the
de nuestras
well-being and the quality of
gracias.
life of our populations. Thank you very much.
Thank you so very much. And we do apologize for the audio, the poor audio that we had during the presentation. It came through for some persons, but not as well for others. So we are very sorry for that and apologize for that. As I mentioned, I did have some questions for the presenters. So first, if you can both turn on your cameras, thank you. And I would like to ask Kathleen, first of all, we have this morning launched the regional guidelines, and I would ask you, based on your experience with the targeted technical cooperation that was provided through the Hemispheric program, what do you consider should be the first step in implementing the regional guidance? And how can organizations such as the OAS and PAHO best support this process?
Sure, thank you. Well, as I mentioned in the presentation, we have policy and guidelines, and of course, we've been working with this document, giving feedback over the last year or so. And I think this will be very familiar to a lot of the countries in the region, especially who are working in the school feeding space with what is recommended here. School feeding programs, having a policy that supports, having multi-sectoral everybody working together to support different ministries and so on. But when it comes down to the practicality of actually implementing, you have to look at what resources are available. Do you have the infrastructure to implement these guidelines? And many countries do not. And so I think it is important at this time to really focus your resources and say, all right, the countries are completely on board with your policies. Their barrier is that they do not have the infrastructure to implement. How can we support the countries in finding that financing, doing the sustainable funding so that they can realistically implement these policies?
Okay, thank you so very much for that very valuable insight on the implementation. And I'll ask the same question of Catalina. Let me repeat it. Based on your experience with the targeted technical cooperation that was provided to Colombia through the Hemispheric program, what do you consider should be the first step in implementing the regional guidance that was launched this morning? And also, you can tell us how organizations such as OAS and PAHO can best support the process.
Muchísimas gracias. Como les decía, fue fundamental para nosotros la cooperación
Thank you very
técnica.
much. As I was telling you, technical cooperation was key because it was a facilitator. It facilitated getting closer to the educational community, and it also strengthened the technical cooperation between us to harmonize the technical process from 3 points of view: health, education, and sports. It is really a cooperation that is useful to provide sustainability to the processes to achieve what Leslie was saying in her intervention, having those detailed indicators for processes, intermediary indicators, and impact indicators so that these projects are visible, so that we can measure cost effectiveness, and so that they can call the attention of decision makers to have investment processes that are financial and from the human resources point of view. If we can show that these processes are cost effective, that they are transsectorial, intersectorial, we can make decision makers act at a national and subnational level.
All right. Okay, so thank you very much for that. And I'd like to thank both our presenters from Colombia and from Belize for your participation this morning. And at this point, I'll turn over back to you, Leslie.
Muchas gracias, Audrey. Muchas gracias, Caitlin y Catalina, por estas
Thank you very
presentaciones.
much, Audrey, Caitlin, and Catalina. Thank you very much for sharing your experiences that have certainly nourished this document, but I also think that they're an inspiration for those that are with us today. And now we're going to go to our second panel. We have a panel with civil society
titulado De las
on
recomendaciones a las acciones.
called From Recommendations to Action. And for this, I asked my colleague, Fabio Gomez da Silva, who works at PAHO as an advisor. He is going to moderate the session. Go ahead, Fabio. Thank you very much, Leslie. In the first place, I'm going to start, I'm going to present our three panelists. This morning, we have Beatriz Champagne, which is the Executive Director of Healthy America class. Thank you, Beatriz Champagne, for being with us. Jorge Vera de Marco, President of the Global Alliance for Healthy Nutrition for Girls, Boys, and Adolescents for Latin America and the Caribbean. Thank you very much, Juan. Welcome. Mike Hutton, who is Executive Director of Healthy Caribbean Coalition in the HCCC. Thank you very much and welcome. And Veronica Shaw, Vice President of Food and Nutrition Policies from the Global Health Advocacy Incubator. Thank you very much, Veronica, and welcome. And so with this presentation, in the first place, I would like for you to tell us how you see these recommendations translated into actions and how from your organizations and specifically from civil society and other players, this tool could be used to take forward policies in school environments. I would like to start with Veronica. Maybe you could mention your first impressions, but also how you see these guidelines and how we can strengthen advocacy with government, civil society, and other actors or players involved in development, implementation, and policy compliance to strengthen healthy environments and make them healthier.
Hola, ¿qué tal? Buenos días, buenas tardes a todos.
Good afternoon to you all. First of all, thanks to PAHO for the invitation and congratulations for the launch of these guides that will certainly continue strengthening food, school nutrition guides in a region. So my first reaction regarding the guide, I would like to highlight some matters that we think are very important from the incubator. The holistic approach, the guide, considering not only the need to regulate with evidence-based better practices, the availability and sale of ultra-processed products in the schools, promoting the prohibition of ultra-processed products. This is a fundamental element because the availability of ultra-processed foods, it is impossible to compete from an education and promotion point of view. And we would also like to prohibit all kinds of advertising. So it's not only the question of availability, it's the question of marketing. And it's also a matter of sponsoring. This is very worrying for the school environment. This is very important. And also, talking about the holistic aspect of the guides also talk about the access to food through school food programs, and it establishes clear criteria for public procurement. This is a huge budget in our countries, and these budgets needs to use these resources to buy nourishing food and not ultra-processed foods. And the guide recommends the use of the PAHO Nutrient Guide to define the availability of food at the schools, but also public purchases, because this is another great strength. So it's not only the reduction of unhealthy foods and beverages, ultra-processed foods, but also access policies. And another important aspect shown by the guide is very comprehensive because it connects public purchases with family agriculture and small-scale purchases so that governments commit with regulatory frameworks in which public procurement will guarantee a significant and growing percentage for family agriculture and small producers to guarantee on one side fresh real food and on the other hand promote local economies. The guide also covers public exercise promotion, and we also talked about the democratic principles to protect. And I wanted to stop a minute at the commercial determinants and the management of conflict of interest. This was less evoked today, and I would like to say that it has to do with the commercial determinants that interfere in the design of these policies and the need to have an appropriate management of interest conflicts, conflicts of interest.
Remite a la normativa y a otros materiales, manuales complementarios de la OPS y de la OMS para el manejo adecuado de conflicto de interés, pero esto requiere ser aterrizado, tal vez nosotros desde sociedad civil podemos colaborar en eso, a herramientas más concretas de lo que eso significa, dado la terrible preocupación que hay. Yo diría desde el incubator nuestra perspectiva es que si hay una política pública donde la industria de ultraprocesados está interfiriendo de manera agresiva en múltiples formas, es en la alimentación escolar. Y no solamente porque las escuelas están inundadas de ultraprocesados a través de oferta y en los alrededores de las escuelas, que también requiere ser regulado, sino porque hay un masivo marketing de productos ultraprocesados. Como dije, el marketing no es solo publicidad, también es promoción. Y programas con alianzas público-privadas de las empresas de ultraprocesados con los gobiernos en casi todos los países del sur global, incluyendo nuestra región, que es muy preocupante. Todas las empresas grandes de ultraprocesados tienen programas de educación física en las escuelas, y esto es importante remarcarlo. Sí, queremos educación física en las escuelas, pero no esponsoreada por Coca-Cola o por alguna empresa de ultraprocesados en alianza con los gobiernos. Sí, queremos agua potable en las escuelas, pero no a través de un convenio público-privado con empresas de ultraprocesados que, aprovechando la vulnerabilidad y la limitación, establecen estos convenios que por supuesto los colocan en una situación de poder que después les permite interferir con el diseño de políticas, en las mejores prácticas, con los mejores estándares. Y decía, estos acuerdos público-privados todavía tienen mucha presencia. Mencioné actividad física como uno de los focos o promoción de agua
I
potable.
mentioned the physical and we also have educational programs of nutrition with different corporations. We have Nestlé, Unilever, all kinds of companies of ultra process that are not the adequate actors to be in the nutritional issues in the schools. So we need an active role of civil society that would give us general terms, concrete and operational levels in implementation. And I would like to mention that these are very much made, especially in the schools, and that's to reformulate the ultra process with vitamins and minerals to try to accommodate it to the public acquisition standards of schools, and to be able to be there creating this false perception that their foods, ultra processed, are reformulated and enriched with vitamins, minerals, iron, will be the solution to malnutrition. So we think it's fundamental to have this highlighted, and we develop this and on the complementary issues to land concretely these things. And I would like to offer the collaboration and cooperation, and also to highlight it in this guideline, the intersectoriality that we have spoken a lot, including the participation of civil society. And the participation of civil society, as they mentioned, and the design of policies to its implementation, and then the actions of interference and industry to collaborate with the governments to guarantee policies and And I'm going to stop here because I have so much more to say. Thank you, Veronica. And I think it's very important what you say. There's a holistic, systemic approach that tries with the guidelines, but also the need of these guidelines to be at the same time sources for each country and each organization and different partners to be going more in depth in certain actions that they want to do. And in this sense, this document is an articulator of different tools that from PAHO we are developing and civil society can develop as well. As for example, the triage tool that we mentioned in the document that has been adopted by other countries. For example, in Brazil, we have the instrument to safeguard the policies against the interference of the industry and conflict of interest. And the idea is to have the tool to be articulating all different tools. And we are developing and ending now a tool that is going to be a legal standard on laws, on labeling and food for schools that would delve more in depth on those points that you, and we want to thank you for your contribution. Let's go to Juan. I think that SANA has a very important role to articulate not only the civil society, but also the agencies of the United Nations and governments, highlighting not only the topic of policies based on evidence, but also the need to ensure food and in the schools and some other elemental issues like the right to improve food intake. And in this sense, how does Alsana see these guidelines? And how do you think this can be useful for the work done by the Alliance? He's muted. I'm sorry. And in very short, a brief impression, our alliance for the health of children and adolescents has as a purpose to protect the right of childhood to a sustained and healthy food intake. We are an alliance for civil society and academia, but these guidelines that you present are an extraordinary tool that facilitates the design and implementation of these policy actions that are towards an environment, the school environment, for this to be healthy and to protect the current and the future health of childhood. But it also emphasizes the part of sustainability for our planet, protecting the right of our children for a future, a healthy future. I would say for a future in terms. But for Alsana, these guidelines are going to be a very useful tool to support the countries in the protection of children and school age. That is my first impression. I don't know if you want me to stop there or you want me to talk on how I see the use that we will do in Alsana to this guidelines. I think that we really get with these guidelines an incredible instrument, and I want to thank PAHO. I see that these guidelines would allow to reinforce our advocacy issue at work with governments and actors that integrate in one document a technical and operational approach that for countries to be able to develop, implement, monitor, and on this school environment. Our experience in the region has indicated that the implementation of these kind of policies in the school environments in certain countries must consider the characteristics of infrastructure, organization, and local capacities of school systems that vary vary a lot in our region, and also the specific needs of each country that are molded by their nutritional and food intake environments and the challenges for the promotion of health. One thing that I liked about the guidelines is that they are conceived as a flexible guideline. That is, that it can be adapted to the requirements of each country and of each school system, and that makes it very useful precisely because of its flexibility. Our Sana model is based on cooperation amongst countries that have already successful school guidelines and those that don't have it yet, to learn from the successes and to diminish the failure risks. This model would be reinforced with the use of guidelines that incorporate the experiences and lessons of these three countries, as mentioned. And hence, these guidelines include already the exchange of experiences through examples that are contextualized, that are transferable. The Alsana model is based on scientific evidence. We are an organization where more than half of us are academic. And this I like because it has a review of experience and that identify the characteristic of programs and policies with the possibility of being successful, like the mixed interventions that combine education with physical activity, but with modifications given the environment. I like that approach to say pedagogic is very important. But if we do not modify the environment through regulations, pedagogics will be short-sold. It's not possible to implement. I like that very much. Another strength of the guidelines is that it considers the commercial determinants that Veronica has already spoken about, including the very vast availability, accessibility, publicity, marketing, sponsorship of ultra-processed, and the interference of the food industry in the policies and nutrition policies, that many agencies ignore it as if this didn't exist. And I really like that Pajo takes it on his, they take the bull by the horns and they face that because it is the main obstacle for the healthy environment for the children. If there is one major obstacle, is the food industry. Fabio, to summarize, the current activities of Alsana will be reinforced with the use of these guidelines. And we really help. Thank these work and this document. Thank you very much, Juan. And you highlighted the topics and issues and some questions and answers that we have been handling during this webinar that we had. I mean, sometimes we have the policies in certain schools, but we have the absence of policies outside and supplemented to the schools. Sometimes the parents, the families that are exposed to publicity, to marketing, to the extra school environment on health, on food intake, compromise the final result. And that policies, these guidelines that are going towards the whole environment, school environment, can be articulated with other policies. And that is to look for this regulatory system that goes beyond schools and on what is conflicts of interest every time, more and more in our countries, in our partners. We are trying to ensure that the public.
We're trying to ensure that public policies prevent conflicts of interest. It's not like we will take out the policies and then we will try to safeguard the policies. No, the conflict of interest, the safeguards are an inherent part of the policies, just as policies to protect school environments. And in that sense, I would like to listen to
hear from Maisha what and traveling to the Caribbean now. What is the from the Caribbean context? where do you see what is your first impressions about the guidance that is being launched, and also how you see its use for the work of the Healthy Caribbean Coalition and other actors in the Caribbean, as your organization has done so much already on this area, and there's so many tools there, and how this could provide support both technically and politically. Thank you very much.
Thanks, Fabio, and thanks for inviting us, and congrats to PAHO and OAS on the development of this toolkit. As you've mentioned, HCC, for us, this area, a policy area of regulating the sale, the marketing, the availability of ultra-processed products in school settings is a really key area for us. And so in 2023, we established our regional school nutrition policy network, which creates a platform for governments as well as civil society and other actors in the kind of school nutrition policy ecosystem to come together, to learn from one another, to share experiences, and ultimately to accelerate progress on these policies in the region. And so we see this new guidance as a really invaluable addition to this work, and it provides practical, adaptable, evidence-based guidance, including experiences from CARICOM member states, which we value. It recognizes the importance of safeguarding against commercial interests, and we've heard Veronica talk about this in the previous speaker, as well as highlighting the importance of civil society engagement. So we really see this tool not only as an important tool for member states, but as a key tool for civil society to build capacity to participate again in this advocacy, and also to serve as an accountability tool. In terms of from the Caribbean perspective and actually implementation of this tool, I think we need to be cognizant of our small island developing state reality that we have in the region, which is very unique. Most countries have limited technical and human resources, and actually we saw that that's kind of cross-cutting, but our unique context in the region is important to take into consideration. And so first of all, I think it's going to be really important to promote alignment and harmonization with existing regional and global guidance, so countries receive very clear coordinated support. Secondly, practical implementation support is critical, and we've seen this through the network. So countries will benefit from this tool because it is a practical tool, it's adaptable, and we heard, it's flexible. Also providing other support, policy and legislative guidance. And Fabio, you talked about the legislative guidance that you're working on, use of implementation checklists, and importantly, also examples from neighboring countries. We have our network chat, and we were just sharing how Kathleen's work with the water coolers and ensuring that there's strong evidence-driven to drive the policy around what's the alternative. And so those examples from countries is really helpful. Third, peer-to-peer learning, again, incredibly valuable, creating opportunities for governments and other key actors to exchange on challenges and solutions. And then ensuring that there's support, fourthly, for implementation over the long term to sustain the implementation of the school nutrition policies. Countries will also need assistance in monitoring and evaluation. And then fifth, I think, this has come up over and over again, this idea of commercial determinants, and we know that they are the major barrier for NCD prevention and control policy. And so I think governments really need to be provided with institutional and governance-based tools, conflict of interest policies embedded within their governance structure to support management of conflicts of interest and avoidance of undue commercial influence, again, within our SIDS context. And then finally, inclusion of civil society. And we've seen that civil society is recognized as a valuable partner. We generate evidence to guide policy, drive public awareness. HCC has just launched a regional campaign around marketing of ultra-processed products in school settings. We've just had a regional initiative where over 8 countries' youth have come together called Hope for the Future to call for robust school nutrition policy. So civil society have a really unique role to play, again, around advocating for commitments, monitoring implementation, and helping again to ensure that we're watching and ensuring the commercial influences are not, derailing these school nutrition policies. So, I think that's a quick summary of the role I think that this guidance can play and the considerations we need to think about when rolling it out within the Caribbean context.
Thank you very much, Masha. And I think you brought us to also other important questions which relates to this build of political will and the necessity of bringing that will from commitments to action as well. So I think that is something that we also hope that the document the publication can help in doing so. In addition to bringing the technical elements, also serve as a tool that will help building that will. And then once we build that, we will move from the commitments to the actions we need the states to take. Y volviendo al español en seguimiento a este punto, me gustaría preguntar a
And
Beatriz,
let's go back
escuchar
to
también sus
Spanish. I would also
impresiones
like to
y
ask
ya
Beatriz about her
pensando,
impressions,
o sea,
thinking about
como eres, bueno, y Class ha sido un
class
campeón
has been a
en
champion
realmente
in terms
establecer y
of
fortalecer esa
establishing and
capacidad de la sociedad
strengthening
civil en la
that
región de
capacity of civil
Latinoamérica.
society in the
Y
Latin American
creo
region.
que
And I believe
una de
that
las cosas
one of the
nos gustaría
things
conocer es
that we would like
cómo
to
ves
know is
el
how do you
documento
see
como su
the
primera impresión,
document?
pero también
What are your
cómo
first
ves la
impressions? And
posibilidad de que él
also,
también pueda
what are the
servir
possibilities to
para
use this
fortalecer y formar
document
esas
to
capacidades, porque
strengthen
sabemos muchas
and
veces
train those
vamos
capacities?
a un
Because we
país
often know
todavía
that we go to a country
donde se encuentran grupos de sociedad
and
civil
we
que están trabajando
find
en otros
civil
temas,
society groups that are
necesitan
working in other
movilizarlos,
topics. We need to
formar y
mobilize them,
fortalecer la capacidad para temas
train and strengthen their
más
capacities
específicos
for
o
more
cambiar
specific
desde
topics
o ampliar desde su
or
tema de
enlarge
incidencia. Y quizá esa puede ser,
their advocacy scope.
pues, nos gustaría escuchar cuál es la
I would
utilidad que
like
puede
to
tener
listen
en
about the
esta tarea
I would
que
like to know
llevan
more about the
ustedes.
usefulness
Gracias.
of this document and the tasks
Gracias,
that you
Fabio.
carry out. Thank you
Yo la
very much,
mirada que las personas
Fabio.
que hablaron antes en el
Well,
panel prácticamente
I
dijeron todo
the people that
lo que yo ya
spoke
tenía que decir.
before me in the panel
Estoy
have
tratando de
said what
ver
I
qué
wanted
más
to say,
puedo
so I'm
agregar.
trying to say what else
Pero
I
hay
can
algo que
add.
nadie
But there's
mencionó.
something that no one
Class, la
mentioned.
Coalición América
Class,
Saludable,
the
trabaja
Coalition for a Healthy
principalmente
America,
apoyando,
works mainly to
acompañando a
support
cambios de
and
políticas a nivel
accompany
nacional.
policy changes at a
Una de
national
las cosas
level.
que está
And one of
ocurriendo en
the
nuestra
things that is
región
happening in our
y que
region
es preocupante
and
es
that
que
is
muchos de los
worrying is that
gobiernos y nuevas
many of the
administraciones
governments
en la
and new
región
administrations in the
están en
region
contra de
are
regulación y
against
están en contra de
regulations and are
regulación
against
así masiva. No importa
regulation
si
massively.
ayuda a los
It
niños,
doesn't matter if it's
si
helpful
mejora
for
la
children,
salud
if
o
it's
mejora la
it doesn't
alimentación.
matter if it
Entonces eso
improves
es algo
health
que está ocurriendo
or
en muchos
nutrition. So
países.
this is happening
Y
in
creo
many
que
countries.
cuando eso
And I think
ocurre
that
a
when
nivel
this
nacional,
happens
en
at a
realidad
national level,
abre una oportunidad
it opens
real
an
a nivel
opportunity to
estatal,
act
provincial y
at a
local.
state
Y una de las
level, at a
cosas que me gusta
provincial
mucho de
level.
estas
And one of the
listas
things that I like very
lineamientos
much about these
es
guidelines
precisamente
is
que son
precisely that
modular,
they
adaptables,
are
flexibles y que puede
modular, adaptable,
funcionar a nivel
flexible, and they
nacional,
can
a
help at a
nivel
national
estatal y
level,
provincial como a
at a
nivel
state
local.
level, as a
Y
provincial
yo
level,
creo
as
que
well as at a
eso es
local level.
un
And
gran
I believe that
beneficio de
this is
cómo
a
se han
great
concebido
benefit in
los
terms of how we
lineamientos.
conceive these
La
guidelines.
cosa es que, claro, pensando así
Um,
ambiciosamente,
and if we think
estuve
ambitiously,
considerando
I was
que
considering
esto es una
that
tarea
this
enorme,
is a
porque
huge
hay
task
miles de escuelas en
because
nuestra
there
región.
are
Y
thousands of
cómo
schools in a
uno
region.
puede
And how
llevar
can
adelante
we
este esfuerzo de
take
una manera
forward this
equitativa,
effort in
de una
an
manera que
equitable manner,
se enfoque en derecho y en
in a way
equidad.
that focuses
Y
on rights
pienso que a
and
lo mejor
equity? I think
como
that
una acción regional puede considerarse
a regional
la
action
diversidad que
can
tenemos en la
consider the
región
diversity
y
that we have in the
buscar
region and
identificar los
seek
segmentos de escuelas
the
o de
segments of
países
schools
que
or the
realmente
segments of
nos
countries
permita
that
llegar
will allow us
a
to
poblaciones
get to populations
menos consideradas o
that are
que
less
tengan
considered
mayores problemas en
and
sus
that have
escuelas,
more problems
porque
in
de
their
estas
schools.
miles de escuelas,
Because out of
muchas a
these
lo mejor
thousands of
necesitan
schools,
menos
maybe
esfuerzo,
some
pero hay
less,
muchas que van a
but there are
considerar mucho.
some,
Escuchando a Catherine en Belice, por
but
ejemplo,
there are some that will need
una de
much more
las
effort, like
acciones
what
que
we heard
puede
in Belize.
realizar la
One of
sociedad
the
civil
actions that can be carried out by
es,
civil
por
society
ejemplo,
is, for example, to promote that public budgets go to the protection of children. The Belize public should consider the need to have fountains in schools, and this has to do with economic determinants or commercial determinants of this problem. We cannot go to these public-private partnerships. Actually, it is a responsibility of governments, and if that responsibility exists, civil society can promote and that's what we do from civil society. They can do that so that governments can also focus on these priorities. I cannot imagine other priorities than fountains in schools in Belize. So this is a civil society task that can contribute with what ministries of education are doing, ministries of health, agriculture, so that we can have a significant impact. And if I may add something else, I don't know if I'm taking too much time, but obviously I love all aspects regarding the regulatory environment, because it is in that environment that one can get to all children in an equitable manner. And these are things that we are doing, like drug labeling, promote taxes for sugar beverages, and these things that we are doing have very important impact in our schools and in the school environment. And I think that this is something that we do not use enough. These guides show us how we can use the importance of protecting childhood and protecting the healthy school environment with a good nutrition, with physical exercise when we have Trump labeling, or when we have taxes for sugar beverages, or when we talk about public procurement. I'm going to stop there. I don't know if that's okay. Thank you very much, Beatrice. I think that you are touching upon a very important point, and we're going to give some more time to each of you so that we can close these questions on how we could support the countries to be closer to the recommendations brought by these guidelines from civil society, from governments, from agencies, so that you can comment on how we can support the countries. But before that, I would like to highlight what you were mentioning regarding the importance of having involved other governmental actors that have a key role in establishing education policies. So we truly believe that the right to appropriate food, the right to health are interdependent with the right to education, so that investment and budgets that are allocated for education must include enough budget to ensure that food is appropriate. And we have seen many questions from participants, how can we do if what is considered for food in your country is insufficient in terms of vegetables or fruits? Well, it must not be insufficient. It must ensure we must ensure an appropriate nutrition, and so it has to do with the budget element, with the financial element, to make sure that education is committed with these rights that are interdependent. And so now we're going to go to a final round so that you can comment in 1 or 2 minutes how you can in your organizations and how from PAHO we can support countries to go to these recommendations.
If you want, you can start, Beatrice.
No, yo creo
I think that
desde nuestra entidad ya
from our
hacemos
entity,
mucha capacitación.
we do a lot of
No hemos
training
hecho
already,
capacitación
but
en
we
guías
haven't done
relacionados a los entornos escolares,
training
a las
on
comunidades.
guidelines
Esto
on
pudiera
school
ser un
environments.
ámbito muy
This
amplio
could be
de
a very
área
broad
para poder avanzar
approach
en
on our tasks to go ahead in this specific topic of
creo que
schools.
esta
And I think that
capacitación
this
es
training
posible
is possible
en el armado de coaliciones.
in doing
Una primicia,
coalitions.
estamos planeando
And
una
we're
reunión
going to tell you
regional
something. We're planning a regional meeting of civil society and non-transmittable diseases in April next year. And we are even speaking about where we're going to have it. And I think that in this space, although we weren't speaking about school environments in that space that we're going to do, I think it's very important to speak about the school environments and the role of civil society in our region in the school environment. Thank you, Beatrice. Masha?
Thanks, Fabio. So again, back to what HCC can do. We have this regional network, and we think it's an important platform for supporting implementation of the guidance. Just to remind everyone, the network consists of 13 member states, representation from ministries of health, agriculture, education. We also have important regional partners such as the Caribbean Public Health Agency, the OECS Commission, FAO, and the University of the West Indies. So really kind of very diverse network. And so we can commit to really supporting the dissemination of the guidance through the network. We are providing this very uniquely dedicated regional space, which is focused exclusively on school nutrition policies. The membership also consists of, I think one thing we've not spoken about enough here is youth organizations, and we have strong representation of youth organizations in that network. So it really provides a space for sharing and learning, and we can push the network and champion it through our other. Beyond the network, HCC will continue to champion the guidance through our advocacy, our partnerships, will help to raise awareness and encourage uptake across the region so we can maximize its impact. But I think our main engine of support will definitely be our regional school nutrition policy network. Am I frozen or?
No, I think we had a problem with Fabio.
Okay.
So, yeah, don't worry. Así que le voy a pedir ahora a Juan Rivera.
I will
nos
go
puede
now
dar.
to Juan Rivera if he can give us his last words. I'm concerned Fabio's disappearance, but I hope he will appear again. Well, the first thing is that the guidelines are very much aligned with at least 4 of the 10 recommendations that we have for the government. So we are fully aligned and supporting these guidelines and taking benefits of it. And also, PAHO is a part of the board of directors of Alsena. So in that sense, we are very committed with promoting and using these guidelines that were presented today in our supporting task for the countries to implement healthy food intake in the school environments. And really, we appreciate your publication of these guidelines. Thank you very much.
Perdón, mi computador simplemente
I'm sorry,
decidió
my
cerrar
computer
y ahora
decided
tendré que
to close,
continuar.
so
Muchas
I
gracias,
have to go through
Juan.
my
Cerramos con
phone.
Verónica.
Thank you, Juan. Now let's finish with Veronica.
Gracias, Fabio, qué suerte que
Thank you,
volviste.
Fabio. I'm so glad you came back.
Sí, yo quería comentar cómo
I
podemos
wanted
nosotros colaborar desde el
speak about how
incubator
to collaborate since the incubator and certain comments on what Beatriz was saying. It's connected and how we can collaborate. Beatriz was saying that there's a growing trend on the governments in our region, and thank you for the comment. It's important that these are governments that tend to deregulate and to disperse all the what was achieved, and we see it with the labeling in Mercosur, and we see more governments, conservative governments, winning the elections in the region. And not only that's the deregulation, there's a trend of these governments to defund social programs, and that is a terrible threat to the funding of the food, school food. And we see the going back in countries like Argentina with the defunding of food in schools. And so this is something that we haven't spoken, how to fund the school food and how to guarantee the budgets that are needed for food in schools. And from the incubator, we work on supporting the civil society organizations in the case of Latin America and the Caribbean, Brazil, Colombia, Argentina, Uruguay, Jamaica, Barbados, and other countries, and also in Africa and Asia, and many of those. So we work on school food, and Brazil is one of the most successful models. Is that not only do we need to have the ultra processed away from schools and to guarantee healthy public acquirement, but also to have a national budget that is the adequate. And we can collaborate. There's a whole chapter that it's called the budget advocacy to mobilize the resources. That is essential to complete these guidelines because I wanted to mention it, especially on the access of these guidelines. If we don't have the adequate and sustainable funding, it is impossible for our children to have healthy food and fruits and vegetables, food variety, especially to the most vulnerable children. And recently, last month, we had the Sustainable Refunding Initiative of the World Food Program that published a document where we had the chance of participating from the incubator. Two documents published, one on the funding, sustainable funding for food in schools with different stools, and the second, how to use healthy taxes for food. And there we have an incredible opportunity window there. It is to use the tobacco to ultra process and all those taxes, not only to lower the consumption of these very bad products and to decrease the non-transmittable diseases, but also to include the possibility of having a sustainable funding for school food. We're available. We're there on how we can land on this and we can ground this in synthesis, supplementary tools on these to support these guidelines that you're publishing today that would help us to implement them in a concrete manner. I just wanted to mention the importance of the funding and the local partners in Brazil, our social organization that we have been working for years. Every year that they were speaking about the national school food budget, because every year they have how to put ultra processed in public acquisitions. And in December last year, we had a very important political win that was the increase to compensate the inflation on for the national program PNAE in Brazil, and also to guarantee automatic updates. Otherwise, the budgets not only become smaller and smaller, given the inflation, and every time we have less money for the school food, and so we can collaborate with our advocacy tools whenever you need them. Thank you very much. Thank you, Veronica. Thank you, everyone, for your participation. We will give the floor now to the Vanessa Garcia Latzen, our head of nutrition, for her closing remarks. Thank you, Fabio, and thank you to all our colleagues that have participated on this. Very energizing for us to receive your inputs and your comments. And thank you very much of our colleagues in Belize and in Colombia that prepared these presentations that are amazing. amazing. It is very important to hear the civil society and receive their support to work together to see how we can be more effective in going forward to protect the school environments that should be healthy. Thank you, Beatriz. Thank you, Juan. Thank you, Veronica. And thank you. We are very enthusiastic and a lot of incredible feelings on your position on this. And this helped us to continue exploring and how to go forward in this program and broaden it to other countries and to integrate the experiences commented in this webinar today to consolidate environments that are protected. We have spoken about the social, economic, political impact and how this is a multi-sectorial, multifactorial. Thank you, everyone. Everybody, especially our team for risk factors for the Pan American Health Organization, our colleagues Leslie Bejar, Fabio, Audrey, of course, and our colleagues of OAS, Jesus, and all their team that have participated in this effort so much, so engaged in these last 3 or 4 years. Thank you, everybody. The material will be available very soon on our webpage and as well as the publication. And we hope to find again in another opportunity. Thank you, everybody. And thank you for our interpreters as well. Thank you, of course. Thank you, everybody. Take care.
Gracias.